Hi, this is Dr. Simon Feng. We're all familiar with the campaign to call addiction a disease. Unfortunately, calling addiction a disease has not really been effective at fighting stigma. The main reason may be that addiction is now thought of as a mental disease or illness. Mental illnesses, of course, are still shrouded in stigma. In this video, I will argue that addiction should be thought of not as a mental disease, but as a chronic medical disease. Let us begin by comparing alcoholism directly with diabetes, which everyone should agree is a chronic medical disease. These two conditions might seem totally different, but the fundamental features of both conditions are actually identical. To begin, both alcoholism and diabetes runs in the genes. Socioeconomic environments contribute greatly to the development of both conditions. For example, diabetes is twice as common in Mississippi as it is in Colorado, while per capita alcohol consumption in New Hampshire is 3.5 times higher than in Utah. Lifestyle choices play large roles. Lack of exercise and reliance on fast food promote diabetes, while lifestyles that include regular alcohol intake may foster alcoholism. Both conditions affect multiple organ systems. Diabetes frequently affects the kidneys, blood vessels, and nerves, while alcohol often attacks the pancreas, liver, and nerves. Most importantly, both conditions involve the loss of control over consumption. Diabetics have trouble controlling food intake, while alcoholics have trouble regulating alcohol consumption. Given these key similarities, how exactly is alcoholism different from diabetes? Why would diabetes be considered a medical disease, but not alcoholism? Let us now compare addiction with other chronic medical diseases to show similar patterns that exist also for addiction. We will use 4 totally different kinds of chronic medical diseases as our examples. Number 1, COPD or chronic obstructive pulmonary disease, sometimes called emphysema. Number 2, dementias, including Alzheimer's disease. Number 3, atherosclerosis or hardening of the arteries, which underlies heart attacks and strokes. Number 4, osteoporosis or weakening of the bones from loss of calcium. Despite vast differences between these 4 diseases, all share the following features with addiction. Genetic and biological factors are involved. Environmental factors play important roles. Lifestyle factors such as smoking, physical inactivity, or poor diets can contribute. All these diseases feature periodic flare-ups or relapses. All these diseases can worsen over time. They all respond to available evidence-based treatments. Treatments aimed at control rather than cure, and treatments are long-term. If you like, you can pause to slow down this video to examine each disease slide. In summary, yes, addiction is a disease. Addiction is a chronic medical disease because it develops like one, affects patients like one, behaves like one, and responds to treatments like one. If it looks like a duck, quacks like a duck, walks like a duck, and swims like a duck, let's treat it like a duck. Which brings us to the next video where we will discuss how to treat addiction like a chronic medical disease. Thank you for watching.